This is a device which allows image fusion, real-time image fusion. It allows us to bring stored MRI images into a clinic setting and fuse them with real-time ultrasound. The purpose of this is to allow spots in the prostate, which are suspicious, regions of interest we call them, to be to serve as a target for a targeted prostate biopsy. Here's an individual with a prostate shown in brown, ultrasound probe here, body position here, and this individual had a target picked up on his MRI which was not detected by ultrasound and which is outside of the normal catchment for a conventional prostate biopsy. However, when we were able to identify it on the fused image, we could then target it and determine what it's made of, in this instance, a high-grade prostate cancer. Artemis was the Greek goddess of the hunt. We are hunting for prostate cancer. This is a traditional image of the prostate using ultrasound. This is how the prostate has been conventionally imaged for the past 30 years. This is a 3D reconstructed model of the prostate shown in relation to the ultrasound probe here and body position here. This image is created on the fly by the Artemis device using a feed, the video feed from the ultrasound. What we get here that we don't have with a conventional biopsy is this spot, this region of interest here shown on top of the prostate, which is in an unusual location. This individual had a conventional prostate biopsy previously, showed nothing, PSA continued to elevate, and we brought him in, got the MRI, which was interpreted by the radiologist, delineated here on the MRI, and then brought into this clinic, fused with real-time ultrasound, and served as a target for targeted prostate biopsy, allowing us to obtain tissue from a part of the prostate that is usually not sampled. These cores here, each tan line represents a biopsy core. These cores represent the conventional catchment of a ultrasound guided biopsy. However, as you can see, this part of the prostate is outside the normal catchment. And this would have been undetected, and in fact was undetected on a prior biopsy. And the MRI allowed us to see this, bring it into the fused model, and obtain targeted prostate biopsies. Patients appreciate this. They understand this quickly. This is a easy visual to comprehend. We do have a lot of patients who are coming from quite some distances seeking this kind of help, and it's a concept that is not difficult to explain and is quickly grasped by patients. Our best referral source is word of mouth from patient to patient who have been through this. In some patients, the payoff is the finding of an occult tumor which could not be diagnosed otherwise. In other patients, the payoff is in an element of reassurance, a degree of reassurance not possible with conventional prostate biopsy.